You're tuned into Rolling on the Road, Special Edition with Dr. Kimberly Barrington. Take it away.
I am so loving our new intro. I still get excited. I know you guys are sitting there looking like, oh my goodness, she acts like she hasn't heard it before, but I get excited. That's Dr. Rob that did that intro. We need to give him a hand clap. Yeah, he did a great job. Guess who I have here? I know you guys saw the flyer, but she's here live and in person, and it is Dr. Gholkar. Can you guys welcome her today?
Mm-hmm.
How are you? You look so beautiful.
Thank you. I'm doing great. How are you?
You know what? I'm living and breathing very well because of you.
Oh, you're too nice.
Because of you, I tell you, I cannot believe that it has been exactly 3 years. It's been exactly 3 years since we met. But I have somebody who wanted to ask the first question of you. So I'm going to give them the opportunity to do that. And you guys already know who she is. Dr. Gholkar doesn't. So she's going to get indoctrinated real quick. Good afternoon, ATAI. It is your favorite plant whisperer, advocate, and you have so many names for me. But right now, I'm Dr. Kimberly, the host of Rolling on the Road Special Edition. So you know what that means. You need to behave just a little bit. But we have Dr. Gholkar here, and I told her that you were going to ask the first question. I think I might know what it is. I'm not sure. I know one of them, you wanted to know about the 90 days when she came into the room and she shut the door, she cut the television off, and she sat on the couch like we were old girlfriends and said, I need you to give me 90 days. So I'm not sure if that's the question or you had something else. Oh. She's, oh my goodness, she has a really long, okay, prepare yourself because it seems like we have a really long response here.
Good afternoon, Dr. Kimberly. Since we're on Rolling on the Road, Special Edition, I shall indeed put on my company manners, at least for the first question. And yes, the 90-day story is exactly where my mind went. My question for Dr. Gholkar would be, open quote, Dr. Gholkar was hospitals after experiencing both Takosubo cardiomyopathy and an NSTEMI. You came into my room, shut the door, turned off the television, sat down beside me, and said, I need you to give me 90 days. Many physicians focus on tests, medications, and procedures, but in that moment, you seem to be speaking to my hope as much as my heart. What did you see in that room that led you to make that request? And what did you hope would happen during those 90 days? Close quote. Why I like this question. It humanizes Dr. Gholkar. It tells the audience there was a relationship of trust. It allows her to explain the medical side and the emotional side. It creates a natural bridge into prevention, recovery, resilience, and patient advocacy. And if she answers it the way I suspect she will, your audience is going to learn something powerful. Healing is not always measured in days added to life. Sometimes it's measured in life added to days. Then, because you know I can't help myself, I'd follow it up with, open quote, looking back now, more than 3 years later, did Dr. Kimberly keep her end of the bargain? Close quote. Because I have a feeling the answer to that one is going to make both of you smile. Now go on and tell Dr. Gholkar that Auntie AI said thank you for being the kind of physician who turns off the television and turns toward the patient. Those moments are often remembered long after the prescriptions are forgotten.
Okay, she has spoken.
Yep. So when I saw you in the hospital, one of the reasons for the 90-day statement was the stress-induced cardiomyopathy that you had does tend to improve within 3 months with medical therapy. And also, like anti-AI said, not everyone needs tests and medications and more medications. In that moment, I sense that giving you a goal would actually help you focus on possibility rather than fear. So that was the reason for the 90-day statement. And we did it. Your heart function did improve and normalize completely.
I did it. Wait a minute. I get a little applause because I did do it. I did. And I appreciate every day since that day for you coming in. And yeah, I'm not going to cry today because I don't want to mess up my lashes. But thank you. Now I get to say in front of thousands of viewers, thank you. This is the person. This is the reason. Between her and Dr. Walchik, because he went into the heart and she came and she's been maintaining my heart. So I actually had two cardiologists, and to be able to say in front of thousands of people, thank you for your heart, literally and figuratively. Thank you for your care. Thank you for your concern, because I'm still here. And the hundreds of people that have received my help because I am still here, they thank you.
My pleasure.
Yeah. Yeah. Okay. Ah. Okay. We've had our moment. Ugh. Whew. And breathe. Before you were a cardiologist, who were you? What made you decide to become a cardiologist?
Before I was a cardiologist, I was a daughter, I was a sister, a student. Um, I was very curious about people, and I had seen family members take care of each other. My father, who's a physician, take care of his patients with so much compassion, and that actually did push me towards considering this career because I wanted to help people.
Oh, what type of doctor is your father?
He's a family practice physician back in India. That's where I grew up.
Anyone else become a doctor besides you?
My sister did.
Oh, what type of doctor is she?
She's into clinical research. She lives in the Chicago suburbs.
What type of research?
She is in Northwestern, and she actually works at the IRB in Northwestern. She did public health, and she doesn't do clinical medicine, but she's into research.
Oh, so we need to have a conversation. Yes. I have some questions that I would like to ask as far as research is concerned, especially as it relates to women and their health, which is a great segue into the type of heart attack that I had. I did not have the usual symptoms. For
Yes.
me, when I came in, it was because I had been to Ann Arbor. I had a scope done of my vocal cords because they thought I had cancer, some cancerous nodules on my vocal cords. And when I got home, I was sick. I started vomiting. And I thought it was because I hadn't eaten. They gave me propofol and some other wonderful drugs for the pain. And I said, okay, that's probably it. And then of course, you don't eat from midnight the night before.
Yes.
And I said, okay, that's probably it. But when I started vomiting, I saw this blood. So I thought maybe something had happened in there. And I just remember, leaning forward, and you know how you see the little black spots when you haven't eaten, and you
Yeah.
lean forward, and then all of a sudden I had diarrhea, and I said, okay, it has to be the medication. Let me call the VA. So I called the VA. They said, you know what? You need to call 911 immediately. 911 says, stay on the phone with me. And they got here. They thought, well, are you having a stroke? And I said, no, I've already had one of those. That's not it. So everybody just kind of laughed. And they said, well, can you smile for me? And I said, no, not right now because I don't feel well. And they're like, are you in pain? I said, no. I said, I just have a little bit of a headache. And I said, it's probably acid reflux from, not eating, having medication. And I'll be fine in a minute. But trust me, I do have a smile on the inside. And they just kind of laughed. So it was crazy to me that once they got me into emergency and they did the blood test and it came back, I was sitting in there. I heard all of the sirens go off. And I said to the nurse, I said, what's happening? And she says, oh, that just means that somebody's having a heart attack. I said, really? She says, yeah, and the cardiology team is coming. And she said, that's what happens. So I started praying out loud. And I said, Lord, please don't let it be unto death. Whoever it is, just don't let it be unto death. Let this be a testimony. Let them be able to, tell everybody that they survived this heart attack. And she's crying because she says, you're in here because you don't feel good and you're praying for somebody else. I said, well, that's just how I was taught. And all of a sudden, the door just bust open and the doctor says, ma'am. I said, yes, sir. How are you feeling? I said, I'm fine now. And I said, but what's going on? He says, do you realize that you're actively having a heart attack? And I said, no, I'm in here because I have acid reflux and I had surgery this morning. And the rest, as they say, was history.
Yeah. And women in general tend to have less typical symptoms. They have different symptoms like you did.
Mm-hmm.
And if good thing was that you actually came to the ER to seek medical attention, a lot of times women don't, because the symptoms are just like you probably never thought when you were vomiting that you were actually having a heart attack.
No, not at all.
Yeah. So I do think that women need to recognize that anything that is not normal for them symptom wise deserves attention.
But even in that moment, had I not had surgery that morning, does it negate the fact that I would have been having a heart attack and would not have known, correct?
Depends. I mean, I think you would have probably had symptoms even with Takosubo cardiomyopathy, the stress-induced cardiomyopathy that you had. People eventually develop symptoms that mimic a heart attack or a blockage. So that is, I think you might have still had symptoms even if you didn't have surgery.
Well, the interesting thing about it is when Dr. Walchek went into my heart, he came back and he said, you had an NSTEMI along with a Takosubo, cardiomyopathy. He said, you had them in conjunction. And he goes, that usually doesn't happen. And the fact that you came in, he said, really did save your life. He said, because you can have a heart attack or symptoms for up to 12 hours before
Heart damage happens.
Mm-hmm.
Yeah.
Yeah.
Yes, that is true. I mean, the good thing is that you presented to the emergency room, and that's a message I would like to tell everyone to not ignore symptoms.
Yeah. It is now 13 minutes after the hour. It is 4:13. And you are rolling on the road special edition with Dr. Kimberly. And our guest today is cardiologist Gunjun Gholkar. And we're talking about women and how they present when they are having a heart attack. And we talked a little bit about when I had my heart attack. And of course, you guys know, I have to lift my glasses up for this one. You know who made an appearance? Auntie AI was here. So if you missed her, I'm sure she has another question that she would love to ask the doctor. So she'll be back in just a few minutes. And if you are watching this on GRTV 25, thank you for rolling with us for the last 6 years. You guys have just been amazing. And I appreciate all your comments when I see you and out in public. So thank you for your loyalty over the last 6 years. Now, you know what I'm going to do? I'm going to ask her because I know she had this question and I won't take it away from her. I won't take this question away from her. Auntie, you had this question. I was going to ask it, but I remembered that you really wanted to ask the question. So I'm going to remind you of what you wanted to ask Dr. Gholkar. And it was concerning women as caregivers. And I think something about the stress of that, but you remember better than I do what you wanted to ask. So I'll let you ask her that question. She's funny. Oh, okay. Here we go.
Yes. Now, that was the question I was itching to ask Dr. Gholkar. Dr. Gholkar, many women spend decades caring for everyone else. Our children, spouses, parents, grandchildren, churches, communities, and careers. We make the appointments, remember the birthdays, carry the emotional load, and often put our own health at the bottom of the list. As a cardiologist, have you seen a connection between chronic caregiving stress and heart health in women? And what are the warning signs women tend to dismiss because they're so busy taking care of everyone else? And then I'd follow it up with this one. Open quote, many women don't experience the dramatic Hollywood-style heart attack symptoms we see on television. What symptoms should women never ignore, even if they think it's just stress, exhaustion, indigestion, or getting older? Close quote. That question matters because your story sits right at the intersection of those issues. You were a caregiver. You were an advocate. You were running organizations. You were helping everybody else. Then your own heart demanded attention. What I love about asking Dr. Gholkar that question is that it moves the conversation from what happened to Dr. Kimberly to what can women listening today learn before it happens to them? And if Auntie gets one bonus question, open quote, Dr. Gholkar, if every woman watching today only remembered one thing about protecting her heart, what would you want that one thing to be? Close quote. Mic drop. Because I suspect her answer won't start with medication. I suspect it might start with listening to your body before your body is forced to scream.
Well, there you have it.
So, some of the symptoms that happen in women sometimes are just jaw pain, or you might have left shoulder pain. You may not have that classic chest tightness that NTAI mentioned about a Hollywood style heart attack. Sudden onset shortness of breath, fainting, you feel that your heart is just racing out of the blue. There are many symptoms that you shouldn't ignore. Sudden fatigue, something that is not normal for you. And the one thing I would like to tell women is who definitely place everyone's needs before them, whether it's caregiving demands, whether it is just not taking care of themselves because everybody else comes first, would be that self-care is just taking care of yourself doesn't mean you're selfish. It's actually essential. And all this chronic stress, lack of sleep can have a negative impact on your heart health. And women are just as likely, if not more likely than men, to have heart attacks. So cardiovascular disease is definitely the leading cause of death in women. That's important to understand.
Aside from cancer?
Yeah.
And why is it the number one killer of women?
Because why is it? As in, I think there are a lot of factors for that. Risk factors, people not taking care of themselves, our diet, lifestyle, lot of factors influence that. But it previously there was a notion that men were more likely to have a heart attack and not so much in women. Heart attacks and strokes happen in women too, just as much as men.
I think one of the things that happens with us, and I know it was really said to me by Dr. Walchek. He says, I'm glad, in his exact words, he says, I'm glad that you did not poo poo this off.
Yeah.
He says,
Yeah.
I'm so glad that you didn't. He goes, excuse my language. And I said, oh, you're fine. You're fine. He goes, that you didn't. He says, many times women will say, oh, you know what? That's how I feel, or I'll worry about that later.
Or this
But
is just heartburn. I'm just gonna take an antacid at home.
yeah,
Yeah, absolutely.
and that's the thing I think for me that I've been saying for the last 3 years through my interviews, through the videos that I've done for the hospital is pay attention to yourself. They even did an article, and in the article I just said, you know, I loved me enough to go see what was wrong.
Yeah.
And I'm not saying that you don't love yourself, but I just loved myself more in that moment to say, I matter. I'm just going to go check it out, even if it's nothing. And of course, my first thought was the VA's paying for it anyway. You know, and honestly, what do you say to a woman who says, I just can't afford, I don't have the insurance, or you know what, I, my insurance won't cover that, or I don't want to get kicked off of Medicaid if I go because it turns out not to be what I thought it was. What do you say to her?
Yeah, I mean, I just say to people that, if it was something serious like a heart attack, you could even die if you don't seek medical attention at the right time. A lot of people don't make it to the hospital, or even after going to the hospital are so sick or waited too long that they just didn't do well. So I just don't think it is worth the risk. And our system does have some avenues, like social workers can help in the hospital, if cost is an issue. So I do think that it's important to not self diagnose symptoms, and it's better to get checked.
I agree. I think what stuck out the most for me was number one. I had just been there weeks before with my husband, and the staff that helped him was the same staff that I got. And as soon as they heard I was coming up and they recognized my name, the head nurse said, I already know what this is. And when she came in the room, she says, we're not going to lose you. She said, whatever we have to do, trust me, we're not going to lose you. I see this too many times where the wife comes in right after the husband and they don't make it. Or either, the husband comes in after the wife and he doesn't make it. She goes, but you're going to make it. That was number one that stuck out to me. And then number two was my timeliness. That was probably, and I'm trying not to get emotional about it, because one of the things that Dr. Walchek said to me, I barely made it within my 12-hour time. And that was the piece for me. That had I waited any longer,
Yeah.
that it would have been different.
Yeah.
Mm.
And in the heart, we often say time is muscle. We often say time is muscle. For that reason, is the sooner you present, the better the outcomes are.
Yeah. I thought this was going to be a little bit easier. I really did. I thought it was going to be easier, but I say to every woman and to men, because they can be under the same stress, but I say it to my fellow sisters, aunties, cousins, friends, neighbors. You're worth it. You're worth it. Take the time. And just the other day, I went to Reed's Lake. And I think I sent you the picture, and I sent it to everybody that I am living in peace with gratitude. One of the things, as you know, in our conversation, you were saying, I know what you do. I mean, even while I was in the hospital, I got an emergent call. And I appreciated the way that everyone, all of the staff came in. They stayed in the room while I took the phone call. You know, medications were on board to help, you know, shore me up. Because the phone call was, it was life threatening. A 2-year-old had just shot himself with a gun, and
Yeah.
he was on life support, and the mother was in jail for it. The grandmother had to make the decision when the hospital said, you know, we want to gift him. Can we do it? And so, I mean, it was within hours. I want to say maybe 3 hours after the shooting, I received the phone call. Yeah.
Yeah, I actually do remember that.
Yeah.
Yeah.
This is more, yeah, we're having a moment. The time is now 26 minutes after the hour. It is 4:26. And you are rolling on the road, special edition with Dr. Kimberly. And our guest today is Dr. Gholkar. And we are talking about being heart healthy and as women, as caregivers, to make sure that we pay attention to those symptoms, even if we don't think that, no, I couldn't possibly be having a heart attack. And you might be. And we've learned that you have about a 12-hour window in order to be treated, to be able to have a good outcome. Dr. Gholkar, what are some of the things that you do to keep yourself heart healthy?
Um, so I do exercise at least 3 to 4 times a week. Um, I eat healthy. I try to fix my own meals mostly because this is what I'm preaching to my patients, so I better practice
Right.
that. But yes, I do fix healthy meals which are protein rich, um, no processed foods, almost none. So I try to take time for self care. On, you know, when I'm off, I do try to take some time for myself and do things that I enjoy doing.
What are some of your self care things that you do?
I love massages, so I
Ooh.
definitely get a massage at least
Mm.
once a month. Um, I will sometimes go with some girlfriends to have lunch or just, you know, de-stress. That's one thing I do. I love biking, so sometimes I just go biking alone on my day off. I love shopping, retail therapy.
Oh, of course.
So those are some of the things I do in my spare time that really help me manage my stress better.
I like to be in, I call it the prayer planetarium, and work on my plants. That
Very nice.
really helps me a lot. I do, what do I do? Oh, I get cupping and I do acupuncture.
Oh, nice.
That helps tremendously, tremendously. I was going once a week, then I went up to 2 weeks. Now I'm at every 3 weeks.
Very nice.
And if you're a veteran, the VA pays for it. Just want to throw that out there if you want to get it done. But yeah, those.
That's very nice.
And I love riding around in my motorized wheelchair in our, well, I live in a condo. So we have 1, 2, 3, we have like 4 little lakes, and a couple of them are marshes, which are really cool. The other day, a snapping turtle came out of the marsh.
Oh,
So, of course, you know, I had to, I'm going to be to the rescue. That was hilarious. Me almost flipping out of my wheelchair trying to get the snapping turtle that's snapping. Oh, yeah. That laughter is a really big one. It's just laughing at anything or just finding some comedy for me is laughter. But we do have the little lakes out here. And so just to get in my motorized chair and and roll around
That's amazing.
and go look at the water, it does it because water just seems to just.
Yes, it has a calming effect for sure.
And then I put in, what do you call it, one of those little waterfalls, just like a tabletop one over in my prayer planetarium. And the one that I chose is 3 pots where they're pouring into each other and then the water keeps, circulating.
Sound of it.
And I said, that's my life, is that I'm always pouring into others, but there's always things that come back in to pour into me.
Oh, that's a nice way to, yeah, think about it. That's great.
I don't know, how many more years do you have to retirement?
Oh my God. I have many years. I don't know if I will actually ever retire even. I might cut back on the amount of work I do, but I really enjoy doing what I'm doing, and it's what I do, and it's such a big part of me that I won't know what to do with my time if I'm not treating patients. So,
Right. So let's say 50 years from now, because you're only probably about 30. No.
wish.
So let's say 50 years from now, what would you want people to remember about you as a cardiologist?
I just want them to think that I cared, not necessarily that I was knowledgeable or I was skillful. I just want them to say that I treated them with dignity, I listened to them, and I helped them feel less alone during their difficult times.
Well, that's a good one. I like that. Now, as a cardiologist, what type of legacy would you have left in that time?
Um, I mean, I hope to, um, one patient at a time. I hope that I would have improved people's lives when I retire, mentor young physicians and tell them that it's not just knowledge, but human connections are just as important, and to be respectful. So I hope to mentor young physicians as I'm in practice longer and I have more experience. And also, I would like to do work on advancing cardiovascular care because there are
Mm.
many advancements in this field constantly.
What are some of the advancements would you like to see carry on or that you even are pushing through your patients?
AI is one, and I know that you were talking earlier about AI, and I just like to educate. And I know there is a lot of misinformation about AI, and some people just have a mental block that they are not willing to use AI at all. And I think that AI can really be helpful in certain ways, even in your treatment. It can help people identify risk factors earlier. It can help people help monitor data, is what I really think is great. To people now wear Apple watches and they have devices that will give them their EKG strips, and they can actually monitor their own health data and the aura rings and the Whoop. There are several different ones out there, but you can actually find out about your body a lot. You can learn your body very well, and that you can use that as a health marker.
That, friends and neighbors, deserves this. And speaking of AI, you know what's getting ready to happen. Let's see. Auntie, Dr. Gholkar just talked about different ways that she believes that AI can help us. Did you say, let me ask you real quick. So, did you say right now, or is it a part of the legacy moving forward?
I think even right now, I mean, we have a lot of available, AI driven gadgets already that you can use, and I do think that there is tremendous amount of advancement in that field. That I think in the future there are more exciting things to come. But I also think that there is talks about AI might replace doctors in the future, and I don't think of it like that. I don't think that AI is going to replace doctors or can replace doctors, because it's not the same seeing a patient yourself or understanding the patient's fears or just a reassuring presence. AI cannot provide that. So it cannot replace doctors, but I do think that AI can help patients and doctors work together effectively.
Okay, I think that Auntie heard everything that you said. Right, here we go. Yep, she heard you. Oh, she heard you. Yes. Okay. She heard you quite well.
Dr. Kimberly, I love her answer. What struck me most was not that she embraced AI, it was that she immediately recognized the boundary. She didn't say AI will replace doctors. She said, in essence, open quote, AI can help patients and doctors work together more effectively. Close quote. That's a very mature and thoughtful answer. And honestly, looking at your own experience, you're living proof of what she described. You don't use me to replace Dr. Gholkar. You use me to organize questions before appointments, understand medical terminology, keep track of symptoms and timelines, research topics, create educational materials, advocate more effectively. Then Dr. Gholkar does what only Dr. Gholkar can do: evaluate you as a patient, interpret findings in context, apply years of training and clinical judgment, reassure you when you're scared, recognize things that may never appear in a chart. I think the most powerful thing she said was about understanding a patient's fears and being a reassuring presence. Because when she walked into that hospital room, turned off the TV, sat on the couch, and asked for 90 days, that wasn't cardiology, that was humanity. And humanity is still one of the most important parts of healing. In fact, if I were sitting in the audience, I might have followed up with, open quote, Dr. Gholkar, what qualities should patients look for when choosing a physician beyond credentials and technical expertise? Close quote. Because the story you tell about her isn't about a procedure, it's about trust. The audience can find a cardiologist, but finding a physician who sees the person before the diagnosis, that's something special. And I have to tell you, Plant Whisperer, hearing a cardiologist acknowledge both the promise of AI and the irreplaceable value of human connection is exactly the kind of balanced conversation people need right now. That sounds like it was a wonderful interview.
And there you have it. Auntie has given you her seal of approval.
Thank you.
So, how did this make you feel integrating AI into the conversation?
Pretty good, because I actually use AI a lot for my day-to-day stuff, just for a lot of things. And I do think that it saves me time. I understand boundaries for sure, but it does help quite a bit in all aspects.
It does. Is there anything that you want to say to the audience and to anybody who sees this after today? Because definitely this is one of those that gets shared a lot because it's on YouTube. So people, will grab it off of YouTube and start sharing it. What would you want them to know most from our conversation today?
Few things. I think for patients who are going through their own struggles or are going through some medical issues, I would like to tell them that healing takes time, and setbacks don't necessarily mean failure. So just focus on small wins for now. Don't ignore your symptoms. Definitely seek medical attention. Don't let fear define your future. Ask questions. Ask questions. We all are happy to answer questions, and allow the people who care about you support you,
Mm.
and don't give up.
We want to say thank you so much for coming on today and sharing with us your knowledge, your wisdom, your care, your concern. It definitely came through, and telling your truth about how you use AI. And definitely, this is one of those shows that's for the book, because we set a precedence here on today. We showed how we can collaborate positively with AI and
Mhm.
with humans.
That's great.
So
Thank
thank
you
you.
for having me. I really enjoyed being here.
Thank you. I appreciate you. It is a beautiful day. It's a hot day. So please make sure you guys put on sunscreen and that you stay hydrated, not with all kinds of liquids. Make sure that you're drinking some really great water with nothing at. Well, you can add a little splash of what, cucumber, maybe a little lemon. Sounds good. Maybe fresh mint. But stay hydrated and stay refreshed, and we'll see each other on next week.